Welcome to our live session today, hormonal imbalance. What are the causes of hormonal imbalance? We are going to talk about the signs of ovulation, and then when you do a semen analysis test, and then the results show that you have dead sperm cells, what could be the cause of this? In this video today, in this live stream today, we are going to talk about all this. We are going to talk about the reasons why you have dead sperm cells in your urine, in your sperm analysis test. And then also we are going to talk about what could be causing hormonal imbalances. Gerard Massa, the fertility educator, are the names of the channel. I welcome you for today's video lesson. And on this channel, we do create awareness about fertility and reproductive health. So without further ado, we shall go to our first part of the session. We are talking about hormonal imbalance, the causes of hormonal imbalances. What are the causes? So first of all, we shall define what we mean by hormones, and we shall say that hormones are specifically chemical messengers. They are those small chemicals inside your body which play a very big part. Mu video yaffe ya leero tuli kwogera ku mu musomo gwaffe gwa leero tuli kwogera ku biki ebiviirako omuntu okuba ng'alina hormonal imbalances, ate n'ekirala tuli kwogera ku the signs of ovulation, omanya otya nti oli mu kiseera ekyokufuna olubuto, and then tuli kwogera ne ku oba okoze test eya sperm analysis, kiki ekiviirako okubanga olina dead sperm cells, kiki ekiviirako okubanga kwegamba enkwaso zo tezimala bulungi. Gerard Massa, the health educator, gemanya ga channel yaffe, era wegubanga mulundi gwo ogusoose okujja ku channel yaffe, nyiga akapeesa ak'okusubscribinga obeere nga olaba videos zetwogerako buli lunaku. So tuli kwogerako, we are talking about hormones, and we have just defined this, and we've said that hormones are chemical messengers in your body. When you take an example of you are sending a message from one part of from one part to another, and then something which is actually transferring the messages from one part or from one station to another, that's what exactly we are looking at. These are how hormones act. This is how hormones function. They specifically play a very important role in actually enabling you to have some systems function very well. So hormones are those small chemicals which move around your body, and then they go on telling your organs and then your tissues what to do. If at all these hormones, the chemical messengers, reach your tissues, they specifically bring about, or they tell your tissues to either grow normally or to grow abnormally. And then, of course, they grow abnormally, your tissues grow abnormally if at all there are things which are really not in order. So, mu video yaffe tuligamba nti hormones byebyo ebintu bye tuyita chemical messengers ebitambula ng'ate bireetera changes mu mubiri gwo, bye bireetera okubanga kwegamba omubiri gwo guba gufuna ebintu ebimu ebikyukakyuka mu mubiri gwo gwennyini. So we are proceeding with our first part of the question. One of our viewers asked a question, and then she said, what are the causes of hormonal imbalances? Remember, we've talked about hormonal imbalances, and we've actually defined that these are chemical messengers in your body. But now, what brings about your hormones not to balance? We are talking about the causes of hormonal imbalances. So when we have a scenario whereby someone is having changes in their body, and then these changes are involving, let's say you are putting on rapid weight gain, and then you are also maybe losing weight, and then at the same time you are having hot flashes, you are having menstrual irregularities. Now this applies to women. If you are having menstrual irregularities, and then you are also having many changes happening, then we say that these are the signs, these are the first signs of hormonal imbalances. Tuligamba nti kyosookerako okulaba nti wandibanga olina hormonal imbalances, oba ogenda kulaba nga kwegamba omubiri gwo gukyuka, ogenda kulaba nga kwegamba oteekako weight nyingi, ate n'ekirala ojja kulaba nga kwegamba period zo zikyuka, ojja kulaba nga ate otandika okufuna enviiri oba okumera enviiri mu face oba ku kifuba. You actually, among the signs of hormonal imbalances, you will begin developing hair around your face. You will also begin developing hair around your chest. We call this hirsutism. Hirsutism. Basically, it is a condition, it is a situation whereby a woman begins developing hair. It may be little, it may be excessive around her beard. She actually also develops hair around her chest. And then those signs of men, a woman begins getting them. The other thing is that the other sign of hormonal imbalance is that you will begin or you will have what we call a rapid heart rate. Your heart rate will change. If you want to know how or what could be happening to you, this could be a sign of hormonal imbalances. But remember, these are only signs. The only way you have to confirm that you could be having hormonal imbalances is by doing some tests. You actually have to have your doctor do some tests, and then they will be able to confirm what could be happening to you. So we are talking about hormonal imbalances. One of our viewers asked a question, and then she said she actually wants to know what are the signs of hormonal imbalances. We've talked about this. We've said that the first sign of hormonal imbalance is when you actually have a rapid heart rate. You will also have a decreased heart rate. You will have actually a lump of fat developing between between your shoulders. You will actually have that swelling, kind of like an accumulation of fat around your shoulders. And then the other thing is that you will actually have changes in your system. If you are a woman, you will actually have decreased libido. If you are a man, there are high chances that you will actually develop what we call erectile dysfunction. This is among the signs of hormonal imbalances. And then the other thing is, how can you know that you are having hormonal imbalances? We've talked about all this. We have our friend who is joining us. She's called, Philomena Boateng. Hi, she's saying, hi, doctor. Hi, our friend Philomena Boateng. You are most welcome to our live session. On this channel, on this session, we do create awareness about fertility and reproductive health. We answer your questions. If you have any questions in regards to fertility, you can always ask your questions just below in the comments. I will be able to answer your questions. We are proceeding with the signs of hormonal imbalance. We have said that you will also develop changes in your voice. Your voice will change, and when this happens, it could be a sign of hormonal imbalance. Tuli kwogera ku signs eza hormonal imbalance. Tugambye nti a sign esookera ddala ojja kulaba changes nga zibeerawo mu mubiri gwo, and then of course eddoboozi lyo lijja kukyuka, blood pressure yo ejja kukyuka, and then n'ekirala ojja kutandika okulaba nga ate periods zo zikyuka. The other sign of hormonal imbalances is that you are going to have what we call missed periods, or your periods will become irregular. If you've been having periods which are regular, you will actually begin developing periods which are irregular. You see your periods this month, next month you do not see your periods. If this happens, then remember that this could be a sign of hormonal imbalance. Now, in this video, we create awareness. We tell you about what could be happening, but you need to go talk to your doctor who will be able to do more tests on you. In women, we always recommend some tests, including the fertility hormonal screen test. This can be done to confirm what could be happening. They will look at your hormones, including the follicle stimulating hormone. This is a hormone which is responsible for stimulating your eggs, stimulating your follicles to grow maturely, to mature very well. And then, of course, when they mature, there's this other hormone which is known as the luteinizing hormone, which will also be released, and this actually stimulates ovulation. When ovulation has been stimulated or initiated or brought about by this hormone known as LH, then you will be able to ovulate. And remember, we've said that ovulation is the release of a mature egg. So tugambye nti hormones zino including follicle stimulating hormone, waliwo hormone endala. Follicle stimulating hormone yo stimulating amajigo negabanga gakula bulungi. Then waliwo n'endala gye tuyita luteinizing hormone ziyambako okulabanga at least era bikola bulungi omubiri gwe gutambula bulungi. So we have another friend joining us, Princess Stella Maris. You are most welcome to our live session today. And today's topic, we are talking about hormonal imbalances. What are the causes? Remember, you can also ask your question live here on YouTube, and I will be able to answer your questions. So, Princess Stella Maris, you are saying good afternoon, doctor. Yes, good afternoon, Princess. Nice meeting you, and you are most welcome to our live session on this channel. Gerard Massa, the health educator, we create awareness about fertility and reproductive health. So we are proceeding with our session, and the next question was that how can you know that you are having hormonal imbalances? I think we've already talked about this, the signs of hormonal imbalances. Now we are proceeding to the next part of the question, which was what are the signs of ovulation? What are the signs of ovulation? Omanya otya nti olimu ovulation. So, ovulation, first of all, is the release of a mature egg. When we have a woman seeing her periods, for example, today, and then tomorrow, and then the next day, you finish your periods, you are the woman, you finish your periods, we shall actually establish your ovulation by counting from the first day when you saw your periods. The only way to confirm when you are ovulating is you will begin counting from the first day you see your periods. The first day you see your periods is what we call day 1. So on day 1, that is the first day of your periods, we count up to the 14th day. And then on the 14th day, that is the day of ovulation. That's when you are actually going to release a mature egg. So the question is, what are the signs of ovulation? In other words, how can you know that you are now ready to get pregnant? How can you tell that you are ovulating? We are answering all this in this live session today. So we are saying that when ovulation happens, there's going to be the release of a mature egg. But how can you know that now it's the time to actually be with your partner? It's the time to actually get pregnant. The first way to tell that you are ovulating is you have to do some tests. We have some testing strips which are known as the ovulation predictor kits, the OPK kits. The ovulation predictor kits specifically are available at your nearby pharmacy, at your nearby drugstore. You can always talk to your pharmacist who will avail you. They will give you these small kits. They kind of look like these pregnancy HCG testing strips, but specifically these ones, they look for the hormone known as luteinizing hormone. So the first sign of confirming whether you are ovulating or you are not ovulating is you do the ovulation predictor kit test. You do the test, you get your early morning urine, and then you get only one strip, and then you dip it in the morning urine. If it shows positive, then there are high chances that you are ovulating. Because if it becomes positive, it means that you are releasing enough levels of the hormone known as luteinizing hormone. So the first sign of ovulation is a positive ovulation predictor kit test. If you do the ovulation predictor kit test and then it is positive, then that is the first sign that now is the time to be with your partner. Now is the time to actually look at getting pregnant. The next sign of ovulation, or the next way you can tell that you are ovulating, is that you will actually see what we call increased cervical mucus. Increased cervical mucus, there's going to be increase in your changes in the mucus coming from your private parts. And when you begin seeing this on the 14th day or the 13th day from the first day when you saw your periods, we say that you are now ovulating. Tugambye nti omanyi otya nti oli mu ovulatinga, ne tugamba nti ekisookebwako oba kyosookerako okumanya nti wandibanga oli ku ovulatinga, ogenda kulaba nga kwegamba kagundi kano kebayita ka ovulation predictor kit kagenda kubeera positive. Kagenda kubeera positive era we kabeera positive kaba confirminga nti yes wandibanga oli ready okubanga ofuna olubuto. And then netugamba nti ate ekirala netugamba nti ojja kulaba increased cervical mucus ngefuluma, ebi secretions zijja kuba zifuluma wansi nga nyingi nnyo. We are proceeding with the signs of ovulation. The first sign we've talked about is increase in your cervical mucus. The next is a positive pregnancy test. And then the next sign of ovulation is that you are going to actually begin having an increase in your body temperature. You as a woman, at that particular time when you are in your menstrual cycle, and then you actually begin experiencing an increase in your body temperature, that's when we say that you are ovulating. So increase in body temperature is our next sign. When you have an increase in your basal body temperature, you can actually do the plotting. You can get a pen and paper, and then you begin tracking your temperature. When you see a pattern whereby your temperature is just rising, it's going high, then this could mean that you are ovulating. But remember, increase in body temperature could be also a sign of something, some other changes happening in your body. So we are talking about the signs of ovulation. We've talked about increase in cervical mucus, increase in body temperature, and then also a positive pregnancy test. Ask me all your questions so far. If you have any questions in regards to what we are talking about, we've talked about hormonal imbalances, the causes of hormonal imbalances, and then we've also talked about the signs of ovulation. Remember, if you have any questions in regards to fertility, kindly ask your questions and I will be able to answer your questions. So we are proceeding with our next question. And the next question is about dead sperm cells. Someone asked a question and then they wanted to find out what causes dead sperm cells. Actually, the question was that are dead sperm cells connected with infections? The question is, are dead sperm cells connected with infections? If someone has dead sperm cells, does it mean that they could be actually having issues with infections? So our friend, Philomena Boateng, hi, doctor. Remember, we are most welcome to our live session. We also have another friend. She's called Princess Stella Maris. Also, you are most welcome to our live session. I'm really so happy to connect with you. And then we also have Nakabuye Christine. Nakabuye Christine, you are most welcome. Hi, Nakabuye. The session has already started. Remember, every day at exactly 17 hours, we do hold a live fertility clinic where we answer all your questions. We have a chat. You have a chat with me. I ask you my questions. You also ask me your questions, and then we get to learn from each other. You are most welcome, Nakabuye Christine. And Philomena Boateng has a question for us. And first, before we go to Philomena Boateng's question, I wanted to talk about something briefly, and this is about dead sperm cells. When your partner, when your husband does the fertility hormonal screen test, I mean, when your partner does the semen analysis test, sorry about this, male partners, husbands do what we call a semen analysis test, where they will look for the quality and the quantity of the sperms. If the sperms have issues, maybe there's a presence of dead sperm cells, then this could mean that it could be among the reasons why your husband is not making you pregnant. So what do we call dead sperm cells? If you do the semen analysis test and then the results show that they are dead sperm cells, the name given to the presence of dead sperm cells is what we call necrosospermia or necrospermia. So when you see this on your report and the doctor is talking about necrosospermia or necrospermia, this is another term to mean that you are actually having dead sperm cells. If you are a man and then you do the semen analysis test and then you see dead sperm cells, then this is what we mean by that. So the causes of dead sperm cells, the causes of necrosospermia or dead sperm cells in your system could be due to infections. If you are a man and you have repeated infections, there are high chances that the sperms are going to die. Next is if you actually expose yourself to high body temperature, you are a man, and then you expose yourself to high excessive body temperature, then there are high chances that sperms do not survive in high body temperatures, so they can actually die off. And then next is you could actually be having, this could be an early sign of testicular cancer. So if you have dead sperm cells, this could actually mean that you are actually developing early testicular cancer. But remember, this video is for education purposes only. You need to go talk to your doctor who will do more signs or more tests on you. For example, the scrotal ultrasound scan, which will show how your testes are appearing, whether they are becoming cancerous or they are not becoming cancerous, and then treatment will be given. So we've talked about hormonal imbalance, we've talked about ovulation signs, and we've talked about dead sperm cells. Those were the questions which were put forward. Remember, you can also ask your questions live here, and I will be able to answer your questions. So the next question is, sorry. Okay, the next question is by okay, then we are proceeding, and the next question was asked by Philomena, and she's saying that if I had my period on 1st of August 2021 with a 28 cycle length, next week is 29th, but I had my latest period on that cycle, how do I calculate my ovulation days and next period ahead? Thank you. Okay, thanks a lot, Philomena, for your question. You will allow me to do some writing down here. You're saying that you first had your periods on 1st of August 2021, and then with a cycle, 28-day cycle length, next will be 29th of that. Okay, then, but had my latest period on 26th. Okay, then, how do I calculate my ovulation days? Now, thanks a lot, Philomena, for your question. You are talking about how your cycles are. You have a 28-day cycle, and you are asking, you would like to know when you are ovulating. Remember, we've talked about this. We've said that ovulation is the release of a mature egg. Mukwano gwaffe atugambye nti ayagala kumanya ddi lwagenda okuba nga afuna ennaku ze z'okufuniramu olubuto. So when you start your periods today, and then it takes you 28 days to see your periods again, that's what we call a 28-day menstrual cycle. If you see your periods today, and then the next day you are going to see your periods again, it takes 35 days. Then we call that a 35-day menstrual cycle. So in this particular case, Philomena, you have a 28-day cycle, and you want to know when you are going to be ovulating. It's very simple. If you began seeing your periods today is a Monday, and today is the 27th of, basically today is the Monday. So when you begin seeing your periods today, and you want to know when you are going to ovulate again, take today, the first day you've seen your periods, take it as day 1, and then count tomorrow, day 2, next, day 3, count up to 14. And then on the 14th day, count 3 days back. The first 3 days before the 14th day, plus the 14th day, those are the days of ovulation. And remember, we've talked about all this in our, we've talked about ovulation, and we've said that when the female egg is released, for example, if the female egg is released right now, and then it's going to survive for 12 to 24 hours. And if it's not fertilized within 12 to 24 hours, it's actually going to disappear. It's going to die off. It's not going to be utilized. So the female egg survives for 12 to 24 hours. And then the male sperm survives for up to 5 days. So if you want to increase your chances of getting pregnant, you should begin being with your partner, actually the 3 days we've talked about, plus the day of ovulation. If you want to know the day of ovulation, Specifically, you count 14 days, take 3 days back before you reach the 14th day. That's the day, those are your days of ovulation. And remember, the male sperm survives for 5 days. The female egg survives for at least 12 to 24 hours. I hope I've answered your question, Philomena. Remember, you can still ask your question if at all you have any other questions. Amore is live here on YouTube at exactly 17 hours every day. So put it in your program at exactly 17 hours, that is 5 p.m. East African time. Just join me here and we shall discuss your fertility. We shall answer questions directly. So next question is by our friend Nakabuye Christine. Yes, Nakabuye Christine, you are asking a question and you are saying that what causes dead sperms? Of course, when we are talking about dead sperms, we are talking about the husband. We are talking about a man with dead sperms. So Christine, in this particular case, we are answering this question on behalf of men, and it's very good. You'll pass on the information. So there are times when couples have tried to get pregnant and things have not worked out. You've been married for 10 years, you've been married for 5 years, but pregnancy is not happening, and you actually be with your partner almost all the time, but no pregnancy is happening. You as a woman, normally, on a side note, women are the ones who take up the blame, and then they begin actually saying that they have issues. But normally, it could actually be the partner, it could be the husband who is actually having issues. So if a man gets the strength and then comes to hospital, and then they take up a sample of their sperms, and then the doctors perform or they carry out what we call a semen analysis test, it's going to give an overview of how the sperms are, the motility, how the sperms are swimming. It will give an overview of the appearance of the sperms. It will give an overview, the report, the semen analysis report will give an overview of everything, how the sperms are. But if at all we have a scenario whereby your husband has done the semen analysis test, and then the results show that over 80% of the sperms are dead, we call this actually necrospermia or necrospermia. Dead sperms specifically mean that you are having necrospermia. The question that has been put forward by our friend Nakabuye Christine is, what causes sperms to die off? We talked about this, but we shall repeat for the benefit of our friends who have just joined us. When a man is exposed to high body temperatures, the sperms cannot survive in high body temperatures. That is cause number one. Cause number two, when a man is on some strong medications, these medications could be for conditions or they could be for anything that is affecting the man, and then these drugs, actually, the man takes these drugs for a long time. It could actually lead to dead sperm cells. If a man has repeated infections, when we talk about infections, we are actually talking about infections which can be got through the urinary system or which affect the urinary system. For example, bladder infections, also known as cystitis. If a man has chronic infections, then there are high chances that these infections can filter and then go to the testes. That is, the testes of a man, and then they can begin eating up where the sperms are produced, because remember that the sperms actually originate from the testes of a man. So if a man has repeated infections, then there are high chances that they will actually have high levels or high numbers of dead sperm cells, also known as necrospermia. Next cause of dead sperm cells is that if at all a man has conditions, for example, testicular growths or testicular cancer, or if at all there's presence of other conditions like prostate hyperplasia, basically diseases can also bring about dead sperm cells. So Nakabuye Christine, I hope we've answered your question. We've said that the first cause of dead sperm cells is high body temperature, repeated infections, and then of course also presence of other conditions. Gerard Massa, the health educator, is the name of the channel. And remember, you can ask me your questions. If you have any questions, kindly comment down below your questions and I will be able to answer. On this channel, we do create awareness about fertility. We talk about everything related or connected to fertility. So, Nakabuye Christine, let me know if at all you do have any other questions. And I'm really so happy, all you, my friends, for joining me today for this session. Remember, on this channel, we do create awareness about fertility and reproductive health. So, Philomena Boateng, you had another question for us? Okay then. Philomena Boateng, another question for us. You are saying that if the period is 26th of September, okay, 26 cycle length, then ovulation is on the 12th day. So specifically, if at all your periods start on the 26th of September, and then you have a 26 cycle, and then the ovulation is on the 12th day, what you need to do, actually, Philomena, is that the easiest formula is that you basically get the cycle length, which is in this case a 26 cycle length, and then you subtract 14. And then, of course, if you get 26 minus 14, specifically, here we get 2, and then here we get 1. So it means that ovulation is going to happen on the 12th. And I think you've answered this yourself already. Yes, if the cycle is actually 26, then it means that you are going to ovulate on the 12th day. And basically, that is the answer. So I hope I have answered your questions. Remember to leave your questions down below in the comments. You can also join me on my WhatsApp. It's +256 701 7978 and 76. That is +256 701 7978 and 76. I will be able to answer your questions, and also you can post your questions down below in the comments and we shall talk more. So thank you for joining me for today's lesson. And unless if at all there's any other remaining question, we are about to sign out. We're about to end our session for today. And I welcome you, my friends, all of you. Philomena Boateng, thank you for joining us. Our friend Nakabuye Christine, thanks a lot for joining us. And I hope I've answered your question. And then, of course, we had another friend. Okay, then Princess Stella Maris. Thanks a lot for joining us, Princess Stella Maris. Thanks a lot for joining us for today's live session. So, okay, Nakabuye Christine, you are appreciating. Thanks a lot for your teachings. Yeah, I'm really so humbled that you've joined us today. And remember to join us tomorrow at exactly 5 p.m. That is 17 hours. I will be right here and I will be answering all your questions. You can submit your questions right now, and then tomorrow we shall be able to discuss more. So we have some friends who are joining us, and let's check and see if at all they have any other questions, if there's any other questions. Okay, our friend Joy Nkeki, you are saying hello Joy, you are most welcome for today's live session. And just as a recap, we've been talking about hormonal imbalances. We've answered this question, hormonal imbalances, what causes hormonal imbalances. We were also talking about the signs of ovulation. What are the signs of ovulation? We've talked about this. You can re-watch the video, and then in case you have any questions, you can always post your questions. I will be able to answer. And then we also answered the question in regards or regarding dead sperm cells. But just as a recap, we've said that hormonal imbalances, normally hormones are chemical messengers, which are actually very important in telling your body and organs, your tissues and organs what to do. They can go to your ovaries and then they'll tell the ovaries that now it's time for ovulation. Now it's time for pregnancy. If these hormones or chemical messengers do not balance, then there's a problem with your system. And Philomena Boateng, you are saying that, thanks so much, doctor, you got a new subscriber from Europe. Okay, thanks a lot, our friend Philomena from Europe. We are so humbled that you've joined us. Tell more friends from your area to join us every day at exactly 17 hours. We are live here. We are live on this channel. We do hold a live fertility clinic where I answer all your questions. You ask your questions live here and I answer your questions. And thanks a lot. We are proceeding with our video lesson today. And we've said that the signs of ovulation, we say that the signs of ovulation include fertile cervical mucus. They do also increase a rise in your body temperature. And then also there's going to be changes in your cervical mucus. There's going to be changes in your basal body temperature. When you do the test with the ovulation predictor kit, it's going to be positive. And remember, when you have any questions in regards to the ovulation predictor kits, these are testing strips. They actually look like the urine HCG pregnancy testing kits, which test for urine, which test for pregnancy. That is, they look for the HCG hormone. But these ones, the ovulation predictor kits, the OPK kits, specifically, they look for the LH hormone, the luteinizing hormone. So this is actually a hormone which is responsible for ovulation. So if you have a positive ovulation predictor kit test, then it means that you could be actually pregnant. Then we are moving on. Our friends, I'm really so happy that you're here with us. And the next question that has been put forward by Nakabuye Christine, the question is here. Yes, the question is that, what causes abdominal pain when in periods? What causes abdominal pain when in periods? Now, when a woman is in her periods, or when a woman is about to get her periods, we call this the premenstrual period, or that time when a woman is in her premenstrual stage. She's about to see her periods. There are changes that are going to happen. These changes include hormonal changes. The hormones, remember we've talked about hormones before, and we've said that these are chemical messengers. There are many, many hormones, but in this particular case, we are talking about a hormone known as the follicle stimulating hormone. We are talking about another hormone known as the luteinizing hormone, also abbreviated as LH. We are talking about a fantastic hormone known as estrogen, and then another hormone is known as progesterone. Now, when estrogen hormone rises, when the estrogen hormone levels rise, their main function is to bring about the thickening of your womb, of the inside of your womb. They make the inside of your uterus to thicken. It becomes very thick so that when a fertilized egg comes, it actually attaches itself onto the side of your uterus, onto the inside of your uterus, also known as the endometrium. When the egg has attached itself on the inside of your uterus, then it's going to grow. But remember, if at all fertilization takes place, the fertilized egg travels the whole distance. It comes and then it attaches itself onto the inside of your uterus. And then because you have low levels of the estrogen hormone, what is going to happen is that you are actually most likely going to end up with a miscarriage or a very early pregnancy loss before 20 weeks. The question is, what causes abdominal pain when in periods? Now, when this hormone, estrogen hormone, remember its function is to prepare your womb for pregnancy. When the estrogen hormone senses that this particular cycle, this particular period, in this particular menstrual cycle, let's say this menstrual cycle of this month, you've not got pregnant. What is going to happen is that, the hormonal levels, the estrogen hormone is going to actually drop. Now, when it drops, then there's going to be degrading or shedding of the inside of the uterus. Because remember, this hormone, estrogen, specifically, it thickens your uterus so that implantation takes place. But because there's no pregnancy, what is going to happen is that the thickening or the increase in the thickness of the inside of your uterus is not going to take place, meaning that the inside of your uterus is going to shed off. It's going to actually pour, and that pouring is what we call periods. Now, when this shedding is about to take place, when the levels of the hormone estrogen is dropping and then this shedding is beginning to take place, there's going to be blood vessels involved, because the inside of your uterus and even outside your uterus, there are blood vessels which are there. So this shedding of the uterus is going to bring about rupture of these blood vessels. And remember, the body, the female body or the male body, in this particular case, we are talking about the female uterus, it is well supplied with blood vessels and nerves. So as these blood vessels are rupturing to shed in form of periods, then there's going to be pain. The pain is due to the contractions as the uterus is contracting, just as if a woman was in that period of giving birth. She's in the labor ward. She's giving birth. It's still contractions happen. Still, in this particular case, there's also pain. So, to answer your question, what causes abdominal pain in periods? It's basically hormonal, and then also it is basically due to the contractions of your uterus as it is preparing to actually shed out the blood, because in this particular case, you did not get pregnant. So thanks a lot, Nakabuye Christine, and I hope you've got the answer. Yes, you are appreciating. You're saying thanks so much. I'm really so humbled, Christine. Every day we are live here at exactly 17 hours. We do answer your questions about fertility, about reproductive health. Gerard Massa, the health educator, are my names, are the names of the channel, and I specialize in fertility. Anything to do with fertility, we talk about it here. We get the answers. I ask you questions, you give me the answers. You also ask me the questions, and I give you the answers. Remember to subscribe so that you do not miss new videos we release every day. On this channel, we do create awareness only. If you have any questions, you can always leave them here. I will answer your questions. If you also would like to talk with me, not live on YouTube, you can post your question on my WhatsApp. It's +256 701 79 78 and 76, and we shall talk more. Next question put forward by our friend Nakabuye Christine. What causes, okay, Nakabuye Christine, thanks a lot for asking. You are saying that what causes the walls of your fallopian tubes to get attached. Could you rephrase your question, please, Christine? Could you repeat the question? Please, you could retype it so that we can get it clearly. But you were asking something like, what causes the walls of your fallopian tubes to get attached? It's not specific, Christine. I don't know what you're meaning here, but the question is about the fallopian tubes. What causes the walls of your fallopian tubes to get attached? I don't know whether you were meaning what causes your fallopian tubes to get blocked. You could type your question again. Christine, Damo or typing a question here, you can type the question again. I will be able to answer your question. Remember, if you are talking about the fallopian tubes, these are the female tubes. They are actually, if we take, basically this is an example. If we take this to be, specifically, this is our bottle for ultrasound, for doing ultrasounds, but I'm just using this as an example. So if we take this to be your uterus, and then these, the sides of, the sides, basically this pen here, it's basically having, we take an example that these are the tubes. No, we shall use this. If at all this is our uterus, I'm really so sorry. I'll be getting these models very soon so that we can use them live so that we can learn. So if this is our uterus, remember the uterus has 3 layers. It has the outer layer, which is known as the perimetrium, and then it has the innermost layer, which is thick. Normally, it is very thick. It is called the myometrium, that muscular layer. And then we have that fine line which cuts in the middle of the uterus, which is known as the endometrium. Now, if we take this, and then we say that these are the tubes, okay? We are taking an example. We are using this basically as an example. So we say that these are the tubes, okay? So the question is, what causes the walls of your fallopian tubes to get attached? I don't know whether you're meaning attached or blocked, but if you are talking about tubal blockage, fallopian tubal blockage, what makes these tubes to get blocked? If the uterus has issues inside, if the uterus has infections inside, or it has free fluid which has accumulated inside, and then the tubes are actually connected to the uterus, what is going to happen is that the fluid which is inside the uterus is going to actually go and block your fallopian tubes. So when the fluid accumulates in the fallopian tubes, it's going to lead to a condition known as hydrosalpingitis. Hydrosalpingitis is accumulation of free fluid in your tubes. Also, blockage of the fallopian tubes can be due to accumulation of tissues. Tissues or scar tissues, also known as adhesions, can grow inside. So I'm asking for my friend. She was told that her walls of the uterus became together. Okay, then. So still, Christine, you were specifying. You say that you are asking for your friend. She was told that her walls of the uterus became together. Well, really so sorry. We feel for your friend Christine. But what happens is that I actually thought that you were asking about the fallopian tubes and tubal blockage. That's what I was explaining. Still, you are asking that your friend has this problem and the walls of her uterus became together. I will take an example again. Please bear with me. This is not a uterus. It's basically a model. We are using this as an example. So if this is the uterus, a normal uterus, when you do an ultrasound scan, it is supposed to be in a position which is known as an anteverted position. Specifically, in simple terms, it's supposed to be facing upwards. If you have a uterus which is facing downwards, instead of facing upwards like this, and the uterus is facing downwards, then we say it is retroverted. Okay? So if the normal position of your uterus was upwards, which is anteverted, and then the doctor said that your friend has the walls have come together, the inside of the uterus, the walls have come together. What could bring about this? Basically, we go to conditions, or we go to when growth and development is taking place. When this baby girl, when this friend of ours was still in the womb when she was conceived, there's going to be what we call joining or fusing. Okay, the reproductive system, the reproductive parts actually begin when they are together, but with time they go on opening up. They go on opening up, and then we shall have the cervix forming, we shall have the inside of the uterus also forming, and then of course we shall also have the fallopian tubes forming. This takes place when pregnancy is happening, okay? But if at all during pregnancy there were changes that took place, for example, maybe the pregnant woman does not take her folic acid supplements, she does not take her folic, she does not take the advice given to her by the doctors, and she does not take any antenatal medications. This girl, when the private parts are forming in the womb, there's going to be fusion. We call this a genesis. There's going to be joining of the inside of the private parts, and specifically in this case, the uterus may not be able to actually separate very well. It may not be able to separate from the cervix. It may actually, the walls may come together. So as you are saying that you were asking for your friend, she was told that her walls of the uterus became together. This is a congenital abnormality. I don't know whether your friend discovered this in adulthood, because actually most women discover this issue when they grow up. So we don't know whether she discovered it in adulthood, but this can be worked on. It is a surgical condition. You need to talk to your obstetrician stroke gynecologist, or your doctor, who will be able to advise on the appropriate management. But normally, joining of the uterus, when the uterus is joined together, it can be worked on, it can be repaired surgically in hospital. So kindly, Christine, you can tell your friend to go to hospital and talk to her specialist, or gynecologist. They will be able to advise on which procedure needs to be done, and then they will take over the management. This channel will create awareness about fertility and reproductive health. Do you have that burning question you'd like to ask? Your questions, please post them in the comments below. If you would like to talk with me in privacy, then you can actually WhatsApp me. It's +256 701 79 7876. So we are moving on to our friend. She was okay. We are moving on to our friend, and she's saying that I saw my period. Okay, this is Joy Nkeki. Joy Nkeki, I think we've answered your question. And you're saying, okay, you have asked another one, and you're saying that I saw my period on August 30th and September 20. Okay, then. So you saw your periods on August 30th. And then on 26th of September, you actually saw your periods again. I don't know when you were expecting to see your periods, but what happens is that if you begin having irregularities in your periods, if you begin having irregularities in your periods, then there are high chances that you could be having hormonal issues. You could be having hormonal imbalances. There could be a hormone that is not balancing. So the best way to confirm what could be happening to you is that you actually need to do what we call a fertility hormonal screen test. Because if your periods begin changing, it could actually be due to something else. But the number one reason why your periods normally change is it could be hormonal. It could be connected to the hormones. So you do a fertility hormonal screen test, and then also you can do a pelvic ultrasound scan. It will give us a clue of how your uterus is. The doctor will look at the inside of your uterus, and then will be able to tell whether the inside of your uterus is thickened, or there are masses, or there are swellings, or the ovaries have issues. So if you begin seeing your periods changing, it is a sign that you may actually need to do some tests. Okay, so I hope I've answered your questions. And wow, we have another question that has been posted. Let me kindly look and see. I'm asking for my friend. Okay, Christine, thanks a lot for appreciating. And you were appreciating, you're saying that thanks a lot. Yes, I'm really so humbled. I'm so happy that I've answered your questions. Remember, if you still have any questions, I'm right here every day at exactly 17 hours. I'll be able to answer your questions. Mu video yaffe ne ya leero tubadde tuli kwogera, I'm translating in Luganda, but remember, you can still, as the lesson is still proceeding, ask your questions. I'll be able to answer them in English, but I'm translating in Luganda. So mu video yaffe ya leero tuzzeemu ebibuuzo ebya mikwano gyaffe abatujoyininze leero. Tubadde ne Christine Nakabuye abadde alina ebibuuzo byatubuuza ne tubiddamu nga bikwatagana ku periods. N'atubuuza n'ekibuuzo nti mukwano gwe baamugamba nti n'abaana ye ebitundu ebiri eby'omunda bye bayita endometrium byekwata. So ne tugamba nti kino kibeerawo nga omukyala ali lubuto, era ebitundu by'ekyama bijoyininga ne bita separatinga bulungi. Then ne tugamba nti of course ne mukwano gwaffe Joy Nkeki abaliko laba video yaffe ali wabweru wa Uganda naye abadde alina kyabuuza ne nakyo ne tukiddamu. So okay then, so Nakabuye Christine, you are asking another question, and you are saying that there are any, okay then let's get the question. You are asking a question and you are saying that there are any kind of diet to eat so as to maintain the so-called hormonal imbalance. Wow. Okay then, Nakabuye Christine, thanks a lot for the question. And you are asking about the diet you can eat to maintain your hormones in order. What diet is recommended to have your hormones balancing? Now, when we are looking at hormones, remember we've said that hormones are chemical messengers. They tell your tissues, they tell your body organs to do particular functions. If these hormones travel to your ovaries, they tell your ovaries to specifically do their work, produce the eggs so that fertilization takes place. And then if these hormones go to the male organs, they actually bring about sperm production. And then also they bring about all those changes which are supposed to take place in females and in males. Now, when we are looking at a diet which is actually advisable to have your hormones balancing, specifically, you actually should have a balanced diet whereby we are talking about some proteins. You should also balance it with vitamins, and then you should also drink plenty of water. But the most important part here is that you should eat more of green leafy vegetables. These are very, very important in helping bringing about hormonal imbalances. But the overall reason or the overall best management for you to balance your hormones is you need to find out which hormone is not balancing, first of all. Meaning that you need to, first of all, talk to your doctor or your specialist who will go ahead and then request the tests to be done on you. Your doctor will actually do what we call a fertility hormonal screen test. And then they will look at the key hormones which are involved in a woman who is actually expecting to get pregnant. Your doctor will test for FSH, the hormone which is responsible for bringing about your eggs growing, okay, which enables your eggs to grow or to mature. Your doctor will also look at LOH, the hormone which is responsible for bringing about ovulation. Your doctor will look at estrogen, the hormone which is responsible for enabling the thickening of your uterus so that you can get pregnant easily. And lastly, your doctor will also look at the levels of progesterone. Now, when all these hormones have been checked, and then the results come back, and then they show that you have actually what we call low levels of the follicle stimulating hormone, or the hormone which is for eggs, then your doctor will pay more close attention to how this hormone, FSH, can be balanced, okay? The commonest drugs which are used are actually available. Your doctor will advise you on which drugs need to be given to you. And then if the results show that the hormone, which is known as progesterone, is low, and maybe that's why you are having repeated miscarriages, your doctor will also advise you on the drugs which need to be given. For example, your doctor will advise on progesterone supplements. There are progesterone supplements on the market. They are available. You can talk to your doctor who will prescribe you the progesterone, and then you can use this. It can be inserted in your private parts. There's a certain type of progesterone which is inserted in the private parts. And then also there's a type of progesterone which is actually given in form of tablets. And then there's a type of progesterone which can be injectable, which can be injected, which can be used as an injection. So your doctor will advise on which hormonal drug you need. So diet is good in balancing your hormones, but the best management is you first of all have to confirm which hormone are you going to balance, and then your doctor will advise you on this. Thanks a lot, my friends, for joining us for today's live session. Remember to subscribe so that you do not miss new videos we release every day. We hold live sessions just like we are doing right now every day at exactly 17 hours, that is 5 p.m. East African time. I'm always right here with you, my friends. Invite more friends, share our videos on all your social media platforms so that we can have more friends joining us, because there are lots of friends out there who have questions, who would like to get answers just like you're getting. So I'm really so happy, my friends, for joining us today. Sanyuse nnyo mikwano gyange mwena abatujoyininze leero. Wobadde olina ekibuuzo kyonna osobola okukipostinga wano, nja kuba nkiddamu. And remember to subscribe, and remember to put your trust in God, because we can talk to you, we can advise you what we learned, and the most important thing we need to note is that we need to put our trust in God, because everything can be possible when we put our trust in God. So once again, thanks a lot, Joy Nkeki, for attending today's video lesson. Thanks a lot, Nakabuye Christine, for attending today's video lesson. And then also we have other friends. We have other friends here. Thanks a lot, Philomena Boateng, for attending today's video lesson. You subscribed. I'm really so happy. And then also we had other friends. Here. Okay, then we had another friend here, Nakabuye Christine. Thanks a lot for joining today's video lesson. Princess Stella Maris, thanks a lot for joining today's video lesson. Remember to tell your friends, and I will be able to have you tomorrow for the next video lesson. Nakabuye Christine is telling us, thanks a lot, darling. Have a nice day. Thanks a lot too, and let's proceed with our work. I'm really so happy that you joined us today for today's video lesson, and May God bless and protect us all. Remember to subscribe so that you do not miss new lessons we put out every day. On this channel, we create awareness about fertility and reproductive health. Ask me all your questions. I will be able to answer all your questions. Gerard Massa, the Health Educator, is the name of the channel. And on this channel, we do create awareness about fertility and reproductive health. May God bless and protect us all, and have yourself a nice day. Put your trust in God, and see you tomorrow at exactly 17 hours. Bye-bye.